Good evening, classmates. My name is Natalie Castro, and I'm here to talk to you about my Internship 1 Session B internship site. I am currently completing my internship site at Broward Children's Center, located in Pompano Beach, Florida. So a little bit about Broward Children's Center. It's a private 501c3 organization that provides medical, educational, and therapeutic needs to patients from ranging to infants, children, young adults with special healthcare needs. And they promote respite services, therapeutic services, and advocacy for these patients. So a lot of the medical needs of these patients include patients who are diagnosed with spinal cord injuries, traumatic brain injuries, cerebral palsy, trisomy 18, cleft palates, a lot of children that have really complex medical needs that need all around medical care. And within that facility and the medical care that is being provided for them, they also offer all therapy services such as physical therapy, occupational therapy, speech language therapy, and recreational therapy. So my biggest struggle with this specific population at this specific site is learning all of the medical needs, diagnoses of each and every patient that you work with. There's around about 30 patients in the facility, and that is just in the main center. There are also patients in the group homes that average to about 20-25 patients per day, depending on if the patient is located in the hospital for a few days or gets discharged, for example. And just learning how to incorporate their medical needs into your treatment sessions as a recreational therapist. I've seen physical therapy and speech and OT collaborate with recreational therapy in the means of making sure that the patient is positioned correctly in the wheelchairs, that they have splints on, that they're getting suctioned, telling if a patient is having high stats or low stats, oxygen levels, transporting them and making sure all of the cords, the NG tubes, the oxygen levels are okay, their tanks. So just being aware of the medical needs of each and every patient and memorizing them and making sure that you're observing their physical being as well while working with them. For example, there was a patient that wasn't doing so well, and all of a sudden she started turning a little blue when you were looking away doing an activity, and we had to call a code in, and it was for a split second. So anything can happen at any time, and it's really important to be aware of your surroundings and making sure that your eyes are on each and every patient. How I've overcome these challenges, I have made individual flashcards for each patient on a little key ring that I wear during my time at the center, just so that way when I'm working with patients, it gives me a little bit of a, I guess you want to call it a cheat sheet as to what each and every patient needs, just until I get used to it. And I have since week 3. What was the most effective recreational therapy / therapeutic recreation activity technique used with this particular population of patients? So actually I have 2 specific therapeutic activities that we have implemented, one being animal-assisted therapy and 2 being arts and crafts. The patients don't have a lot of sensory stimulation, visual stimulation, because they're in their rooms most of the days when they're not in school. They need a lot of engaging activities such as arts and crafts and socialization. The animal-assisted therapy has been phenomenal. We've had therapy ponies and therapy dogs come visit the patients in the facility, and they completely light up when they see them. It's a little different. And also arts and crafts. They just love all the different themed ideas that we do, and we use those crafts to decorate their room. So it's a little bit more festive, and it makes them feel as if they're, creating these activities for their own room. Even though some of the patients aren't physically able to help you or cognitively able to assist in the therapeutic activities, just sitting by them and talking to them and just really makes a difference. What was the most challenging activity and facilitation technique and why? I feel that with this population, every therapeutic activity was challenging when I was introducing it to them, just because being unaware of not just the medical needs of the patient, but the personality of the patient also, which a lot of people don't take into mind. I was able to, see that some patients had a harder time with their vision than others. So adapting all the therapeutic activities for that specific patient was challenging, especially when it was around 10 patients in the room and doing one activity and having to adapt it 10 different times. So just making sure that you're quick to think on your feet and that you have plan B if one activity isn't going well. Just making sure I was doing that was helpful. So the next question is, at your internship, what would you say is the single greatest moment you have had with a client? So there is a patient that I have connected with. She's in her 20s, and she was in a motor vehicle accident, also abbreviated as MVA in medical documentation. And she lost her mother and completely paralyzed from the waist down, diagnosed with depression, anxiety, PTSD, and she doesn't have the most welcoming personality when you approach her. So my second day there, after reading her chart, I realized all the things that she had been through, and also understanding that she was in an accident when she was 15. So living a life to where you didn't really have any limitations for yourself and having all these dreams of, for example, driving or going to high school, all of these dreams to her fell apart when she got into the accident and woke up to not only her mom passing away, but also being in a state where people are attending to her every minute for medical needs, living in a home without her family, so on and so forth. So I got to get to know her a little bit, little by little, and I've created a meditation schedule for her. I've incorporated therapeutic activities such as arts and crafts, meditation, yoga, cooking, that have helped her, one, eat healthy, so to feel better about herself, and two, make her room more relaxing for her. So her room was a little disorganized and didn't really have a lot of decorations to it. So I worked with her and made it more of a teen-friendly room, but also a room that incorporates a lot of the sensory. So something that smells good, making sure there's fruit in her room, so that way she's always aware that she can eat healthy, and just teaching her about, how to be happy. So it's been really interesting working with a psych patient, and I have actually really enjoyed my time with her. And we are now working our way to creating an autobiography about her and a modeling portfolio, and working with nonprofits around the area to see what modeling she can do, because that's been her dream. So giving her inspiration to continue to view herself as someone positive, feeling positive about herself, and really just having something to look forward to. So the next question is, what do you feel is your supervisor's greatest strength as a therapist, and explain why? So Katie had the recreational therapy program was not ever started since she went there. She went in, she started the program, and I feel that personally, looking at different sites and the recreational therapy program, it could sometimes be harder to be respected as a therapist. And she does a great job at not only having everybody respect her as a recreational therapist, but to also show people of what she's capable of and how rec therapy can really implement, how implementing recreational therapy can benefit a patient with their day, arts and crafts. And a lot of what recreational therapy does ties into the goals that, a speech therapist can recommend, or an occupational therapist or a physical therapist. But a recreational therapist just does a lot of group activities, and they can perform one-on-one, and really just showing the center of how beneficial recreational therapy can be, which I feel is one of her biggest, her greatest strength. And also contacting local individuals to donate to the grant in order to make sure that the center does have recreational therapy. So she's really great at grant writing and just making sure that the recreational therapy department there keeps afloat. So the last question, what do you feel is your greatest strength as a future therapist, and explain why? The one characteristic that I feel would benefit me as a future recreational therapist is to think on my toes, given my experience of having a business, working in different environments such as a preschool, an office setting, a clinic setting, a hospital setting, has really given me the experience to contribute a lot of work skills in those environments. And I feel that is going to benefit me in the long run with that experience. Something that I also feel would be beneficial to me is that I can relate a lot to people. And as far as patients go, I'm really quick on my toes. I can understand guidelines, and I really love creating programs as well. So given that recreational therapy is an upcoming field in a lot of facilities, I would really love the opportunity to start a program at a facility that doesn't have recreational therapy and really just promote the benefits of this field. But I've really enjoyed my time at Broward Children's Center. I'm a little sad it's coming to an end, and I really hope that a lot more students get the opportunity to intern at Broward Children's Center and gain the experience that I have with great therapists and a great team over there, and to use those experiences to benefit themselves as a future therapist. So I thank you guys, and hope you have a great rest of the summer.